Okay, I think I have this section too. All right. So next best action. I know you've probably all heard that before, and it's you've been used multiple times, but in the industry. But I really think that we've got this one, in the fact that we cover, as Annie showed earlier, so many of the what we call core communications that are being sent out to members. Right, and they really are looked at a lot of times like a check the box. We know we have to send EOBs, so we're going to send our EOBs out. We know we need to send our ID card, right? Versus collectively looking at the overall experience of that member and that journey throughout those communications, because we also have a separate set of within the health plans, that it is focused on, like the star ratings, like we talked about, the quality, Medicaid, Medicare Advantage, right? And there are multiple different objectives that they're trying to achieve. There are so many different gaps in care that need to be um, gaps that need to be closed in order to be able to either for pay for performance measures or um, for quality, for your gap in care, for your bonus reimbursements. And usually those areas are looking separately at what communications that need to be sent out, and they're sending communications out. But really being able to connect that together, and like I said, really look at the journey of the overall member and what the touch points are, and really importantly, how you can leverage those core communications that are being sent out with the objectives that you have around next best action, whether it is you sign up for digital, register for a portal, someone with diabetes entering into a diabetes management program, getting your mammogram completed. I mean, there's a whole long list of things that health plans are trying to encourage members to actions to take with many different nudges. Combine it together, get the most that you can out of the communications that you are sending out with a coordinated effort that really connects that experience together for the member. But also, you're it helps impact the reduce the amount of dollars that are spent on communications if you can leverage ones that you're already spending, you're already doing. So leverage them and then supplement it together, looking at that holistic journey. So the next slide, these are just an example. I mean, I could probably create just an unlimited number of objectives here because of what I just listed through. For Medicaid, there's pay for performance measures. For Medicare, there are gap in care measures and star measures, and there's other the fact that people have conditions and you're trying to get them into your vendors that you spend a lot of money, and we know that help people when they can actually enroll in programs, but we know that getting them enrolled is the biggest challenge, right? So medication adherence, nothing new there. We know that people, if they stay on their medications, there's a higher chance that they're actually going to continue to manage whatever condition that they have that they're taking the medication for. And then too, understanding the access to care, right? People who leverage infrequent, we call them frequent flyers for the emergency room, where maybe there's urgent care that they could be going to. They need to know that information. And so, how do you prioritize what your objectives are for a specific population, right? For a specific individual, prioritize those, you know, and then use that prioritization and weave that into all of your communications, right? So if you have a brand new member that's coming in and you want them to sign up for digital adoption and for the portal, have that be top priority. You want to capture their preferences at that point in time. You'd really like to be able to ask them some questions about their health and or their barriers to care, right? So that then you can use that information and go on to the next, so that then the next communication that they get, for example, like an EOB, is what's the next step that you want them to take versus repeating again, register for the portal when they've already done it. That doesn't personalize that experience like what we talked about previously of what members want. And I know everyone on this phone call, the organization that you work for has objectives that you are trying to achieve for specific populations. And you are all sending out materials that are part of your regulatory or core communications. And if you put that together and leverage them and use data in an intelligent way to really personalize that journey for the individual, right? You're already sending all these out. Just coordinate it.